Right, that's it. Yes, so we're live. Just talking to my Instagram followers there. Greetings to my Facebook and YouTube followers. You know who you are. I don't know who you are, but you know, of course I do. Of course I do. Of course I know who you are. All of you. If you have a comment, if you have an opinion or a query, post it. Why not? I'll do my level best to answer it here and now. If you that is my done out chair here, which is in where my on air sign, which setting's important, you know. A lot of thoughts gone into the setting here. It's a bit dark in here, doesn't it? Anyway, if you've got a question, then I'm here to answer it. If you're just here for the info, then sit back and enjoy the ride, because there is going to be some pretty interesting stuff discussed in tonight's program. Things like healing of a birthmark, factors affect the birthmark. Okay, 2 birthmark things: a lipoma on a spine, all sorts, moles, lasers, anyway, all sorts, and anything else that crops up. So anyway, let's get trying it, because time waits for no man. So what we got here is a question that says something like this: how long is the average healing process for birthmark removal on the neck? This is, well, first of all, the word birthmark doesn't have to be there. So it could be how long is the average healing process for lesion removal on the neck, because whether it's a birthmark or whether it's a mole or whether it's a tattoo, you know, it's removal of a piece of skin on the neck, basically. And secondly, I won't say get criticized, but I can understand how people can get frustrated and say, well, how much does it cost to have a birthmark removed? Because the answer is it does vary. And birthmarks can be little things, they can be brown, they can be red, or they can be big. So basically they can vary in size, and that will affect the healing time. If it's a big lesion and it's closed under a lot of tension, you know, the neck's obviously moving, so there's a risk that you can get issues. The good thing about the neck is there is quite a lot of skin laxity, but there is skin laxity there for a reason, because you need to kind of move your neck around. So it's one of those. But you can remove a certain, you know, a reasonable amount of skin from the neck without too much tension. So the tension is important in terms of the healing. So the less tension is under, the better, and the quicker the healing. But in general terms, for removing a lesion from the neck, be it a birthmark or whatever, usually the skin's healed in about a week. So on places like the neck, we probably put a little dressing on there, and the dressing stays on for a week, and then the dressing comes off, and the skin's usually healed in a week. Now, the skin's healed, which means that you normally don't need a dressing. I say usually because sometimes there's little bits that aren't healed, especially if we use dissolvable sutures. There can be little bits where it hasn't dissolved properly, and there's little red areas and raw bits, but broadly speaking, the skin will be healed in a week. So that means you can wash, you can shower, and you don't normally need a dressing. So you normally need a dressing in for a week. Usually, well, I wouldn't say usually, the next one of those ones where you'd often use dissolvable sutures, you might use removable sutures. If you use removable sutures, they would again come out after about a week, because that's around the time that the skin heals. So skin healed in a week, but it won't be full strength. So whilst the skin will be healed, you can't kind of go back to normal activities and start, you know, going to play rugby or whatever. So you need to take it easy for a few weeks. Now, the scar is probably not going to be up to full strength for a few months, but I would say you've got to take it easy for a few weeks and then gently get back into things. As a general rule, we normally say 6 weeks before you start massaging the scar. The scar's often quite firm at 6 weeks, more firm at 6 weeks than it was at 1 week, because the scar is kind of strengthening. The more tissue is going in to reinforce the scar. Your body is making that scar stronger, which is good, but it makes it quite red, raised, and thickened, so it can look more unsightly whilst it's getting stronger. And then it goes through a process called remodeling, which is the redness fades, the thickness thins, and it goes into hopefully a fine white line. But it takes several months to get there, and massaging it in that time can help. And while it's going through that active process, you don't want to get suntan on it, because it will leave you with a tanned scar. So So a week specifically for the skin healing, I would say a few weeks before you do anything too strenuous. A lot of this is guided by your body. If it feels tight, if it feels uncomfortable, don't do it. If it feels okay, it's okay. So listen to your body, and a few months for the redness, the firmness of the scar to sort of fade, to go more skin colored. Generally speaking, all under the umbrella of kind of depends on how big it is and how tight it is and how well it heals. Some people heal better than others, and there might be some delayed healing and some issues that set things back. So it can vary. But that's a general whistle stop tour of healing of a birthmark on the neck. I was also wondering, I was the same person then, is there any factors that can affect having a birthmark removed on the neck? Oh, okay, so it's the same person, two-part question. I was also wondering, is there any factors that can affect having a birthmark removed on the neck, for example, weight, height, etc.? So the main factor, as I've said, is the size of the birthmark. Height is not a factor. Weight is a bit of a factor. So if you're overweight in general terms, you are at a higher risk of complications, particularly in things like wound healing. Smoking will have an effect on wound healing and reduce the chances of it all healing up nicely. So it's increased risk of wound breakdown if you're a smoker. But height, not so much. Weight, yes, but not massively. There are some operations where your height, well, I'll say your height's never really an issue. It's your weight that's an issue, but the height and the weight is combined in a BMI, body mass index, but it's the weight that's the issue, because your height you can't really change. So unless you crouch down, I suppose. But so yeah, if your weight is high, then you are at increased risk. And as I say, some operations, it is quite important. So we will measure your body mass index and we'll give you some advice about that. And maybe we would advise you not have surgery if your body mass index is high. Having a birthmark removed from your neck is not one of those operations. So it isn't something we would routinely focus on your body mass index, as long as it was within sort of acceptable realms. But if you ask the question, would it be better if my weight was lower, assuming you're overweight, then yes, it would be better if you're overweight. But it's not a massive problem. And again, it goes back to how big it is. If it's a small birthmark on your neck, then less of an issue. If it's a big one and you're thinking, God, there might be wound healing problems anyway, we've got to maximize our chance of wound healing, particularly if you want to lose weight. It might be an idea to lose weight first. The other thing you might find if you lose weight, you might have a bit of more skin laxity if you lose weight. So that might help us out if it is, again, as I say, if it is a big one. I have a lipoma on my back near my spine. You can pull the lipoma away and put fingers underneath. Wow. Would I need a scan before you can offer removal? This is a hard one. We often get patients. What we ask you to do, going back to the earlier point that it can be variable, kind of how big a birthmark or a lipoma or a lesion, if you like, is. So it can be difficult to advise you. What we do, and something that I feel is, I guess it's not unique, but it's something that we're kind of pushing as a thing at the clinic, is to ask you to send us a photo on WhatsApp first. So if you send us a photo on WhatsApp first, by first, I mean before you even come to clinic. So don't charge you or anything like that. Just send us a photo on WhatsApp and we can give you an idea from there. And sometimes we'll say, look, yeah, that's going to cost that much. Yeah, that's going to need a scan. That's not going to need a scan. That's going to be fine. But often we won't be able to give you 100% based on the photo. We kind of have to see you. We have to examine you. And this is one of those. So lumps on the back, especially central over the spine, could be several things. So you might be thinking, is it something else? But sometimes we can tell it's, for instance, a cyst in the skin. You can tell it's a cyst in the skin, and particularly if it's not so big, and you might say, well, that's okay, I can tell what that is and I'm happy to remove it, without having any imaging of what it is and whether it's potentially connected to anything from deeper down. So this is one of those ones where if you can send us a photo, that'd be helpful. And I know lipomas are often not visible on photos. So if you can take us a photo and perhaps circle around where it is, that will be helpful and give us an idea of scale. So don't take the photos too close up, or if you do take a photo close up, take one close up and far away, so we can just get an idea what part of the body. Often we don't even know what part of the body it is. You see your spine, it could be over your neck, it could be over your bum, it could be anywhere. So so photo is really helpful. I guess size will be important. If it's big, they'd be more likely to be concerned about needing a scan. If it's small, less likely. But ultimately, without seeing a photo of this, my general advice on this one would be, if you don't mind, we'd probably ask you to come to clinic and we'd see you. If you want, you might want to book a see and treat appointment. But we would reserve the right to say to you, look, I think I'm not really comfortable removing that based on the history and examination that I've ascertained here in the clinic, and I think it'd be better if you got a scan, which we can help you arrange beforehand. So I can't really say whether it is that or not, and it's one that we'd have to probably say to you, we might do it, because there's some areas where you kind of think there's several things. This could be the neck, lumps in the neck, as I say, lumps over the spine. Other areas you're kind of a bit more certain that there's not a lot going on. There's not a lot of other things it could be. So you'd be less concerned. The forehead, for instance, there's just got skin and bone there. There's not many things it could be. Things on the arm and what have you. You're often thinking, well, yeah, I've got an idea what that is. But over the spine, there's certain areas like here and here you kind of worry because there's things called dermoid cysts. There's certain particular areas that you would be concerned. So it's something that's kind of worth a discussion first, which is, I guess, what we're doing. We're discussing it, aren't we? So that's one of those areas where I think you'd want to have a we want to leave it open as to whether we need a scan for that one or not. But that's the whole point about this, the WhatsApp sending us photos, so we kind of avoid too many of those situations where you come perhaps for a see and treat all revved up to have it done on the day, and then suddenly we tell you something, or you find something out on the day and you think, well, I don't want to have it done now, so we try and get things and try and be as transparent as we can about costs and what's involved and stuff before you come to clinic, to save you a journey and to save us, a missed appointment sort of thing. Not a missed appointment, but an appointment where we blocked out a see and treat where you've not had it done. So we try and avoid that as well by giving you as much information before you come, so you can be sure that you want it done. But even so, we always say to people, if there's any doubt and you're not sure, there's no problem at all if you want to go and have a think about it. If you do book a see and treat, we try and be quite relaxed in that regard, because it is a big deal having these sorts of procedures. How do we remove moles? Do we offer laser removal? No, we do not remove moles by laser. I've done a blog about this, which if I could, I'd put it in the post. Put it in the whatever comments. I probably can, but I don't know how. We remove moles with so not surgery, not laser, with surgery. So with we cut them out basically. So you excise them, cut them with a knife. We can do sometimes shaves or curettage, depending on what it is. If it's like a seborrheic keratosis, you can sometimes scrape them, or if it's a kind of raised benign mole, you can shave them, or we can excise them, cut them out and stitch them up. We don't do laser. Laser is good for multiple moles. You've got loads of moles, but you've got to think, why having loads of moles removed? Because it will leave a mark or a scar or whatever. The problem with laser is you can't send the lesion off histology, and certainly for a pigmented lesion, for a brown mole, it's good practice to send it off histology. Even if you think it's benign, it's good practice just to send it off histology, where they look at it under a microscope to make sure that there's nothing wrong with it. But we do not offer laser treatment. In my view, I don't think laser is the first line for a mole removal. But as I say, I don't do it. We don't do it at the clinic, so you're better off speaking to someone who does it if you are interested in laser removal, because we don't do it. And one of the things about that we're encouraged to do as doctors is to talk to you about all the options, whether or not we offer them. So we're happy to talk to you about laser removal, And hopefully the laser removal people will talk to you about excision. But as I say, if you want a full view on it, you should probably talk to a laser person about it. But I've got my view about laser mole removal, which I've, as I said, I've done a blog about it, and I don't think it's first line for pigmented lesions myself. But you know, it's a free country, so you can make your own decisions on that one. And I know why it's not popular tonight. I know everyone's getting revved up for the football, so it's it's not a personal slur on me. I understand that. So I understand you're all watching the football tomorrow. You'll all be watching this replay. I'm wondering where everyone was. Well, I tell you, that's where they were. They were watching the football. So I guess there's a pre-match amble. Is it 7:21? So it's yeah. I mean, I'm a busy guy myself. I'm going to go and watch the pre-match amble myself. So. Well, if that's all, I'm out of questions. I'll be honest with you. That's the end of my questions. I will. Obviously, I've got a lot to do, so I will go and do that then. But next Tuesday, yeah, you heard me. Same time, same place. Facebook, YouTube. Obviously, got a huge following on those platforms, so that's great. Instagram's still a work in progress, but yeah, I will catch you same time, same place. If you've got any questions, post them, and I'll do them next week. And yeah, hopefully we'll we'll be watching the football tonight and having a good time. Yeah, let's all have a good time. All right, yeah, come on. See you then next week. That is, yeah.